So Lagos, I have the duo of Damilotun Olejia. That surname is so unique. Yeah, she's on the show. She's a mom, and she's joining all the way from Canada. I also have Dr. Olabode Oshodi. He's a consultant general surgeon with LASUTH, Lagos State University and Teaching Hospital. Dr. Olabode has over 15 years of experience in clinical practice. His areas of specializations include, but not limited to, neck, breast, and abdominal surgery, also trauma and accident surgery. He's a fellow of the West African College of Surgeons. Nice to have both of you on the show. Dami Lotun too has a lot going. She has a lot of profile, huge, fantastic, but she just prefers to be called mom for now. Great to have both of you on the show.
Thank you.
All right. Damilotun Olejia experienced what is called gigantomastia during her pregnancies. I mean, twice. And then Dr. Olabode is here to educate us further on that once she's done sharing her experience. And by the way, have you heard of the word gigantomastia before, Lagos? How about gynecomastia? I mean, gynecomastia has nothing to do with what we are discussing today. Gigantomastia, according to my research and from a conversation with Damilotun, it's an abnormal large breast. She's going to be sharing her experience because, according to research, I also find out that normally when you're pregnant, your breast naturally grow bigger. It's part of our nature as women, so it happens. But when something that is very unusual happens, when you notice something, because we understand there are changes in breast size or shape. Your breast may change during different points in your life. For instance, it can happen when you have your period and when you are pregnant, often enlarging due to hormonal changes. So without wasting time at all, Damilotun, you are not a first-time mom, are you?
No, I'm not.
But during your pregnancies, you experienced gestational gigantomastia. Lagos, that thing is not gigantic. It is gigantic. Okay, let's learn some English today. Not gigantic. Oh, I think when gigantic is gigantic. All right. Okay, so Damilotun, tell us your story.
Okay, thank you so much for bringing me back on the show. So I'm a mom of 3. I would say that in my first pregnancy, I didn't experience gestational gigantomastia, So, of course, pregnancy is different for every woman. Every pregnancy is different. And for different women, we all have different experiences. And like you mentioned, sometimes during pregnancy, due to hormones, is normal for people's breasts to grow a bit bigger,
right?
So at that time when I was pregnant for my first son, I just relocated to a new country, but I knew that the way my breast was growing, something was wrong. And because there's little or not much report about gestational gigantomastia, it's a very rare condition. It happens to maybe 1 in 100 women in the world. So we didn't know what was going on. So when I relocated to a new country, started seeing doctors, complaining. They first didn't want to even believe me because, that's the first time they were seeing me. So in their mind, they're like, maybe this person is just busty. It's normal with pregnancy for your breast to grow bigger, but as it progressed, it was very, very excessive, such that I couldn't fit into my proper bras. I went to get, fitted bigger sizes bra, and they were not all fitting me at this point. So obviously we knew something was wrong. And at that point, the stress of relocating, mentally, and all of those things. In fact, my husband had gone to Nigeria back because he was still working in Nigeria, but he had to rush back again to Canada because it was that bad.
Wow.
I started having, my skin was breaking. I started having sores, so I couldn't even go out. I couldn't wear any top. I had to be wearing just hospital gown, it was really traumatizing. Aside from the physical pain that you can't lift yourself, carrying. I mean, from a C-size cup to a breast as large as maybe like a M or N size
Wow.
cup. If I had to wear a bra, but I couldn't wear it, and because of that, I developed infection. I was in ICU for a while. My baby had to be born early. Those were some of the complications that came with it. But with the second pregnancy, because of course, if you have that situation, if you get pregnant again, the chances that you would have it is very, very high, 98%. So in my second pregnancy, I believe that it was quite easier. It was, of course, my breasts were still larger than the first time. But personally, I had a mindset shift. And of course, I had a great support system. My husband was very supportive. My mom was around. My doctors already knew how to manage my case. So this was the second pregnancy with this situation was quite easier because we were dealing with it from an informed perspective, right? Because initially we didn't know what was going on, right? I just stumbled on a report the first time, that's when I was able to tell the doctors, okay, this is what was going on and all of those things. But I had good care, and I thank God for life, and my kids are healthy.
I'm happy. I'm thankful to God on your behalf as well. So,
Yeah.
Damilotun, thank you so much for sharing your story. You made us understand that the very first time it happened, it was strange, but the second time that it happened, I mean, you were more informed at that point. But when you were preparing to have the second pregnancy, that you also experienced it, did you give you some kind of concern that, oh, we are going to be getting pregnant again? Am I going to be going through this? Did you already know, or it was during the course of
Okay,
the second
so
pregnancy?
it was quite I'll be very honest, like I wasn't expecting to be pregnant again because of course I went through like this valley of shadow of death sort of, right? So basically I had what we call in Nigeria like a copper T, a form of contraceptive, but my doctor didn't insert it well. That sort of a thing. So I knew maybe it was just in the will of God, of course, to have my second son, that kind of thing. So when it came, it was actually a traumatic experience because looking back at what I've gone through. So that really made me down, for the first 3 months of pregnancy. But going into the 4th month, and I was seen at a specialist hospital. Here in Canada, it was a children's hospital. So they already had my case. We already knew, the next line of action to take. Initially, they were saying, or because it was life-threatening, do you want to abort and all those things? But I dealt with it in my mind first. That's what's the worst that can happen. But I had great people around me. I had my husband, I had my mom, I had my mentors, of course, and with God on my side, I was able to pull through till the end. For the first pregnancy, I had to deliver at 32 weeks.
Okay.
Right, but with this, at the second time, I took the pregnancy to term. If you understand.
Fantastic!
So yeah.
Oh wow! So in your first pregnancy, or even both, what week of pregnancy were you at the time of these experiences?
Okay, so to be honest, I think for the first pregnancy, I noticed it as early as, because I'm very observant. I noticed it almost early, but I felt, I don't know, like as women, even if you're on your period or you just feel when your breast is quite heavy, right? So I just felt, okay, I'm pregnant, my breast is heavy and all those things. So even while on the flight relocating to Canada, I felt like it was heavy because it was not fitting into my bra. When I got here, my friend and I, we went to buy a new bra. The new bra again, after like a few weeks, it wasn't fitting, right?
Wow.
I ordered another bra, like, and it
I got
wasn't
it.
still fitting, like after a few weeks. So I had to be using wrapper at some point.
I'm sorry.
So yeah, I would say as early as 10 weeks for the first one.
Wow.
For the second one, because it had happened before, I would say as early as 6 weeks, really.
Okay. But did this happen to both breasts?
Yes, but one was quite bigger than the other.
Even naturally. So
Yeah.
that's also a factor. And then did it interfere with the pregnancy at any time? Okay, yeah, you did say that you had your baby quite early, the first time. Then the second time you carried the baby to term.
Yes.
All
Yes,
right.
because yeah.
Okay.
Yes.
Thank you so much, Damilotun, for sharing this. Lagos, Dr. Oshodi, Olabodi Oshodi, is going to be educating us right now. Please stay here. I'll be right back.
The most common drug that damages the liver. Welcome back. It's Maternity Line.
All right, if you're just tuning in for the first time, this is Nigeria Info 99.3. You are tuning to Maternity Line, and I am Zainab Yakin. Today we have Damilotun Olejia, and she had just shared her experience on Gigantomastia. Right now, Dr. Olabode, please, what exactly is Gigantomastia? Are there types of this gestational Gigantomastia?
Um, okay, thank you for having me. Um, Gigantomastia is it's a rare condition in which there's a disproportionate enlargement of the breast. It could be one breast, it could be both. When it's associated with pregnancy, then we call it gestational gigantomastia. But it can certainly happen to non-pregnant young ladies too, especially girls that are just achieving
Oh,
puberty.
okay.
Yeah,
So
in
it
my
is not
practice in the
peculiar.
last 10 years, yes, in the last 10 years, I have seen three non-pregnant women with gigantomastia and three pregnant ones.
Oh,
So I think maybe I've seen a lot. So I saw the first one in 2008 and then the last one in 2021.
wow.
So it's quite and it's quite burdensome. So
S-
if you look at the two periods, there are periods where there is estrogen spots. So it has led most people to deduce that it is as a result of excessive expression of estrogen. And then because at about that time, too, there's also an expression of estrogen receptors because just like for drugs to act in our body, the drugs need to bind to what we call a receptor, before it works. So the same thing for hormones to work in our body, estrogen needs to bind to the receptor. So it is postulated that maybe there are plenty receptors on the breast, and then once estrogen touches them, it encourages the breast to grow rapidly. However, there have been cases where the hormone is normal, the receptors are normal, yet this patient still develop gigantomastia. And
So,
sometimes people have said that, okay, you want to come in?
okay, yes. From what you have said so far, I understand
Yeah.
now that it is not peculiar to pregnancy alone,
No.
because non-pregnant young girls can as well have it. Do we have any age brackets in this context?
Yes, young girls, usually from age 12, 13. So most men will erroneously take them as grown-up girls and then, they tend to have early attraction. So usually from age 12, 13, the three young girls I have seen were between 12 and 15.
Right.
The last one I saw in 2021 was 13 years. So that is the non-gestational type that happens in the young age group.
Okay, are there strictly of two types, or there are other types of gigantomastia?
Yeah, well, generally speaking, there are strictly of two types. It's the
Okay.
pubertal and the gestational.
Okay, can you talk to us on what exactly causes this condition during pregnancy? Is it hormonal changes surrounding pregnancy or lifestyle behavior, which I assume include food consumption?
Well, for the gestational one, people have come up with three, people have restricted it to three main causes.
Okay, tell us.
Some agreed on excess estrogen production, Other people agree that it could be excess estrogen receptor expression. That means the receptors are the estrogen hormone will bind to in the breast. There are now many of it, plenty of it. So, and once estrogen binds to the receptor, it encourages breast to develop. I mean, it is normal for breast to develop to increase in size during pregnancy. But when these receptors are overexpressed, then the growth is let's say geometric. The third one is that people have come up with maybe it's an autoimmune disorder. Autoimmune disorder is a complex thing. I cannot begin to break it down, but let's just say that you have a situation whereby your body is reacting to itself.
Hmm.
Your body cannot distinguish what is yourself from what is not yourself. So you have the soldiers of your body who are supposed to help you fight infections, fight maybe glass that enters your body, fight every foreign object that enters your body. They are not attacking the body. You know. Now, pregnancy is one of those symptoms that can
Hmm.
trigger those autoimmune disorders. Like all of us are aware of SLE.
What does that mean?
Now, that is systemic lupus erythematosus.
Okay.
It's a situation whereby the body produces antibodies that continue to eat up body parts, eat up the joints, eat up the heart, eat up the brain, eat up the fingers. It can eat virtually all the parts of the body, even eat up the kidneys. The person have failure of all of these organs. Now, pregnancy. So some people can be genetically predisposed to developing this condition,
Hmm.
but when they are pregnant, it comes out earlier. If you were pregnant, it could get like 40, 50, 60 years before it comes up. But when they are pregnant, pregnancy can trigger it. So
Oh.
people believe that pregnancy is a trigger to autoimmune disorders, and in which people now say gigantomastia is one of them. So
All
those are the three causes.
Okay, thank you so much for that explanation. So, are you saying the fact that it can be triggered by pregnancy, does that mean it can be prevented? It's
Yeah. Of course, if you never get pregnant, you won't have gigantomastia of pregnancy.
Oh
Yes.
wow. Okay. But from my conversation with Damilotun, are you there? Hello, Damilotun, can you hear me?
Yes, I can. I'm
Okay.
here.
Yes. I from my previous conversation with you before we brought everything here on the air, you did made me understand that even doctors, they did not understand initially, so they had to go into research. It was a lot of that. So Dr. Labode, does it appear as though research is also indicating that the reason is yet fully unknown or understood by medical professionals? How true is that? Because she said they were trying to find out.
Well, I think what she said is a little bit different from the root cause. She said that the doctors were not aware. It's possible that some doctors are not aware because it's not, I mean, it's just about 100 cases reported since the 60s till now.
Hmm.
So, I mean, so it's not a common disorder. But in terms of the root cause,
Hmm.
we're not.
Hello. Okay, let me use this opportunity while the internet is still buffering. Lagos, the numbers to call are
Under
01.
parasites.
Okay, doctor, please
Oh,
hold that thought, doctor. The numbers to call are 01 465 if you want to be a part of this conversation or you have a question for the doctor, or perhaps you've seen someone with this experience in the past. Okay, WhatsApp number is 0809 the general line is 0700 993 Let me pick this call. I have more questions though.
Yeah,
Hello, good
yeah,
afternoon, Nigerian Info.
good afternoon.
Good afternoon,
This is Mr. Frank.
Mr. Frank. Nice to have you on the show.
Yes. See, some that a long ago, I have come across this kind of thing, and they said that the cause of it is that when all these young ladies are growing up, some of them used to try as much as they can to do all these figure eight shapes. Some will go and do injection.
Mr. Frank of God.
Wait now. They will go and do injection to keep their body in as in one baby. So when they start having like
But,
do something like abortion, then by then the breast will then push out. But
Mr.
so
Frank.
I want the doctor to check if it is true or false.
Okay.
And again, all these people that is doing surgery bomb, that sometimes the thing will then push out in essence that it cannot be controlled again.
All right.
So let the doctor tell us if it is true or false.
Thank you so much, Doctor.
I'm experienced
Mr.
man.
Frank. Somebody was also trying to call. I wish you could call back so Doctor can take both questions. But Doctor, did you hear what Mr. Frank said?
Yeah, clearly I had it.
Okay. Well, how would you respond to that?
No, it's not exactly. It's not. He has no relationship with whether they've had abortion before or they are doing some body contour surgeries. He has absolutely no connection with it.
Okay, doctor, are there therapies available? Because I understand you're pregnant with a baby. This is me assuming anyway, it's impossible to go to do surgery unless it's a life-threatening case. So in this kind of case, Damilotu carry the second pregnancy to term. So does that mean there are therapies that helps in managing the situation, the condition till end of delivery?
Oh yeah. Well, I will say that Damilotun's own was still manageable. I mean, conservatively. So that it depends on the severity. For the less severe one, you can use some conservative approach. You can make special brassiere for the patient. Personal hygiene, making sure that the areas of the breast you use some what we call barrier dressings, like the regular pseudo cream. You make sure that there is less friction between the skin and other parts of the body, and good nutrition, and then control of infection by the doctor, because once the breast enlarges, it will encroach into the chorion on the skin and it can ulcerate. You have sores everywhere. It can be smelling. If somebody does not have good hygiene, it can develop life-threatening infections there, and it could be really, really life-threatening.
All right.
However, if it gets terribly bad, then the patient may need drugs for control of the increase in size. We usually use bromocriptine. The worst case scenario, patient may need surgery.
Okay. So my last question, you did mention food, depending on the kind of food you eat. Are there specific foods so a pregnant woman in such situation should avoid, just in case?
Essentially, she should avoid fizzy drinks. She should avoid fatty foods. She should avoid smoking. She should avoid alcohol. She should avoid, and as much as possible, we want them to eat natural food and fruits and vegetables, high protein food like eggs, fish, prawns. Those are the things they should eat, and then avoid mostly preservatives.
All right. Thank you so much, Dr. Olabode Oshodi, also Damilotun Olejia. Appreciate your time on the show today. Lagos, I see your call. Somebody is trying to call now, but we're now out of time. Dr. Olabode, I'll always reach out for more education as regards maternal and child health. Thank you so much.